Many disorders, instead of going for a later stage and finding out them and where they are not treatable, it is better to treat them at a lesser point of time itself. We have many problems regarding breast carcinomas. We have cervical carcinomas, endometrial carcinomas, where the patient does not have any kind of symptom, but they produce at a last stage, like a fourth or third stage, where they come with severe symptoms where they are not treatable. So instead of going for non-treatable stage, it is better to have an early checkup and then find out if they have any problem or are they prone to any problem. The age group most commonly in women facing problems are above 40 years. That is the first thing. Above 40 years, the common problems that they come with us is any cervical issue, like any cervical erosions which might be causing leukorrhea, that is white discharge, or anything like irregular menstrual cycles, and they are most commonly in the perimenopausal age group, but that is between 45 to 50-year-old. So as such, they feel that okay, we are getting irregular cycles, so this might not cause a problem. After getting a few irregular cycles, our cycles will stop. But that is not the scenario. When you get an irregular cycle, you have to definitely go to a gynecologist and see that what is the reason that you're getting an irregular cycle. Is it because you are going to attain your menopause, or is it because you have any kind of problem in your uterine cavity, or is it because you have any kind of hormonal disturbance in your body which is quite correctable, and that is the reason that you're getting irregular cycle. In a health checkup, what we do is we take a detailed history regarding what is your regular menstrual cycle, how far you're away from the regularity, and how far you're normal, how far you're abnormal. Like see, a vaginal discharge which comes once in a month for every woman, but that might not be normal in your case. So you have to know that what is normal and what is abnormal, which you can only know when you go to a gynecologist. Okay, and when you come to us, what we do is we take a detailed history, we do a per abdomen examination, we do a per vaginal examination and see if there are any local deformities or if there is any cause that you have to be worried about. And we do a pap smear, which is very important because after 40-year-old, every female has to get a pap smear once in a year or once in 2 years. Unless otherwise there is a problem, you have to get it done once in 2 years. Because for early diagnosis, as I have previously told you, for a cervical carcinoma, or if there is any in situ problems like that. And other than this, the investigation part is like we do a complete thyroid profile, which are most commonly diagnosed only after doing a thyroid profile only. And the third one is we will definitely do a sonogram and see if there is any abnormality in the uterine cavity or in your ovaries. Gynecology checkup also includes a breast examination, because one of the most common things that I have encountered in the recent era is that many people have lumps in their breast, but they don't come out with their problems because of the little bit of social stigma that is present. When you come to a gynecologist, a gynec examination also includes your breast examination, where we can evaluate if there are any lumps present, or if they are present, whether they are benign or whether they go into carcinomatous. Benign or carcinoma in the sense is benign is a tumor, but you wouldn't have any kind of problem which might be going with the medications, or you wouldn't need any kind of treatment itself. While carcinomatous, you have to go for surgical or for any other treatment which your gynecologist will be explaining to you. But this can only be properly diagnosed when you go for a gynecologist. So in the gynecology health checkup, we will also include a mammogram as well as a breast scan. These two would definitely have to be included, because you do not, sometimes there are small tumors which you cannot know unless otherwise a mammogram or a breast scan is done. and you cannot eradicate the thing like just on examination you can say that yeah, you have a lump, but this is not big matter. You have to undergo a mammogram as well as a breast scan, and then find out what kind of a tumor do you have, or are you prone for any kind of tumors. Mammogram is only specified for people above 40, and breast scan can be done at any age group. And once you get all these investigations done, the reports will be available within one day, like 24-hour period. And after the 24-hour period, you can come and discuss everything with your gynecologist and find out if you have any problem. And you can ask them like when will be their next health checkup, and do they need it very frequently, or can they wait for another next 2 years. A cervical vaccination. This is best given in a teenage group, okay, like less than 18 and more than 15. And if it is given for every female between 15 and 18 age group, it would be fantastic, because the Cervarix vaccine is to eradicate human papilloma virus, which is very common nowadays, causative factor for cervical carcinoma at a future stage. So to avoid that, it is better to have a vaccination. But it is not like a teenage group is the only person to have a Cervarix. You can have it even after marital life also. But the specific thing is, once you have a Cervarix vaccination, you shouldn't conceive for the next 2 years. Okay? And it is given in 3 doses. Like 0 is the first dose, and after 6 months, and again after 6 months. So like that we give 3 doses. Okay, once you finished your 3 doses, after the 3rd dose, you don't go for pregnancy for the next 2 years. So that has to be kept in mind. So in that case, you can have a vaccination even after your first delivery, when you're not planning for the second pregnancy for about 3 or 4 years of age. Any teenage person or in like 20 to 25-year-old, they only have to have a, not exactly a gynecological checkup, but it would be better if they have a complete blood picture of their own. Why I'm worried for this is, many people do not know what is their hemoglobin level, which can affect your pregnancies once you get your pregnancy. So before going for any pregnancy or any kind of invasive procedure or any kind of health checkup, or before you get married, once I would like all the teenage girls and all the girls who are working, especially who live in hostels, to get one complete blood picture to know what is your hemoglobin level, because these are the people who are getting the least nutrition. Okay, because people who stay in hostels, they don't have proper nutrition that you get at home, and proper hygiene is also not maintained. So for these people, I would have a complete hemogram. What you see in a complete hemogram is, I just list out what are all the things in a complete hemogram. The first thing is hemoglobin, which gives you the percentage of your blood. In layman sentences, it is like the percent of blood in your body is significant with hemoglobin. So when hemoglobin is less than 9, you definitely have to start your iron tablets. Okay, when it is less than 7, then it is severe anemia. Then you have to start with either injections, or you might need a transfusion. You will feel as such you are normal, but unless otherwise you get a hemogram done, you wouldn't know that your hemoglobin is so low, because as such there are no symptoms unless otherwise the hemoglobin is less than 6 or 5. When you go for an ultrasound, the features that you see is, firstly, the uterus. In the uterus, you have to see whether the endometrial lining is correct or not. Any endometrial lining which is more than 13 to 15 mm, and if the patient is past her period, like if after the menstrual cycle, the endometrial lining should be about only 5 or 6 mm. But after the menstrual cycle, it is persistently about 11 to 12 mm. That means the patient is going into endometrial hyperplasia, which might lead into endometrial carcinoma at a later stage. Okay. Next, the second thing that you see on ultrasound is the ovaries. The size of the ovaries, whether there are any cysts in the ovaries, or they are prone to go into a cystic stage. That we have to find out. But if the ovaries are quite normal, if the endometrium is quite normal, the other thing that commonly seen are fibroid uterus, because many people are now coming with, though they do not have any complaints on a general health checkup itself, on an ultrasound we find fibroids in the uterus. Fibroids is nothing but a myometrial hyperplasia. Okay, once you have a swelling in the myometrium, that itself is called as a fibroid, which can have n number of causes. But when to get operated on a fibroid, when not to get operated on fibroid, when you need a medical management, all this depends on the size of the fibroid. So definitely you have to get an ultrasound, know whether you have a fibroid or not, or if not fibroid, it might be going into adenomyosis, or then a number of conditions which are not carcinomatous, like which do not lead to carcinoma, but well, they definitely counter problems in your later part of your cycles, like when you go for 45, 50-year-old, then you definitely have to see that there is a large fibroid which is about 20 centimeters, which definitely need a surgery, which becomes a major surgery. But that fibroid, when it is 5 centimeters, you might not need a surgery. With medication we might try to reduce the size of it or reduce the complaints that you encounter, and then we can manage them properly.